12 warning signs and symptoms of fatty liver to not ignore. Fatty liver disease is a common condition characterized by an accumulation of excess fat in the liver. It can cause pain or discomfort in the upper right side of the abdomen. Most people have no symptoms, and it has no significant consequences. Lifestyle adjustments may typically prevent or even reverse fatty liver disease. In today's video, we will share with you the 12 warning signs and symptoms of fatty liver to not ignore. What are the signs and symptoms of fatty liver? The general misconception that liver disease mostly affects alcoholics is incorrect. NAFLD, non-alcoholic fatty liver disease, is a disorder that affects people who drink very little or no alcohol. Excess fat accumulated in the liver might result in hepatic problems that can be quite distressing. If untreated, NAFLD can advance to non-alcoholic steatohepatitis, NASH, which can lead to cirrhosis and/or liver failure. However, whether or not you consume alcohol, the consequences might be the same if you are not recognized and treated early. To help you, here are some non-alcoholic fatty liver disease symptoms you should be aware of. Number 1. Hypertriglyceridemia. Triglyceride levels that are too high are among the most typical symptoms of fatty liver disease. These lipids are usually stored in fat cells and used for energy. When there is too much fat in the blood, it is not adequately digested. The body retains the excess in the liver, resulting in fatty liver disease. Triglyceride levels in the blood that exceeds 200 milligrams per deciliter are considered high, while levels that exceed 500 milligrams per deciliter are considered extremely high. Although the origins of this condition are uncertain, some doctors feel hypertriglyceridemia is a risk factor rather than a symptom of fatty liver disease. Number 2. Splenohepatomegaly. Splenohepatomegaly occurs when the liver and spleen are both enlarged, indicating fatty liver disease. As the liver stores more fat, the organ's weight and size increase, causing it to push on the surrounding tissue. The spleen and liver might expand at the same time or independently. The spleen and liver both play essential roles in cleansing the body. When they fail to function appropriately, the danger of infection escalates. Do you find this video interesting so far? Please don't forget to subscribe to my channel, hit the like button, and ring the notification bell if you want to see more content like this. Number 3. Ascites. The peritoneal cavity contains a fluid that functions as a lubricant and lies between the abdominal wall lining and the internal organs. Ascites are the accumulation of excess fluid in this cavity, resulting in abdominal expansion. Ascites can be caused by several medical conditions, the most common of which is high blood pressure in the veins that supply blood to the liver, a condition known as portal hypertension, which is commonly caused by fatty liver or other liver diseases. Number 4. Fatigue. Fatigue is a frequent early sign of fatty liver disease, occurring in around half of all cases. In 1/4 of those cases, it is severe enough to impair the individual's quality of life seriously. Mental weariness, which makes completing psychological and physical activities difficult, is widespread and may be linked to the despair and anxiety accompanying a fatty liver. According to research, damage in the liver's capacity to interact with the brain may also contribute to this symptom. The basal ganglia, which deals with voluntary motor control and emotion, is one affected part of the brain. Chronic fatigue is a symptom of liver disease. It might be linked to changes in neurotransmitters in the brain, according to research published in the Canadian Journal of Gastroenterology. That said, if you're always exhausted, regardless of the cause, alcoholic or non-alcoholic, it's best to have your liver tested. Number 5. Jaundice. The body produces bilirubin as a byproduct of the breakdown of old red blood cells. It is partially composed of bile and travels as direct bilirubin through the small intestine. When the liver fails, it is not effectively eliminated and accumulates in the blood, resulting in yellowed skin, eyes, and darker urine. This is an obvious indication of fatty liver disease, but other indicators of liver problems may urge a doctor to request a bilirubin test even before this symptom appears. Number 6. Pain. People with fatty liver frequently describe their discomfort as unclear. Pain can be a secondary sign in some circumstances. Non-alcoholic steatohepatitis, or NASH, is a kind of non-alcoholic fatty liver disease that can progress to cirrhosis, liver scarring, causing body soreness that might be misinterpreted for shoulder pain. Ascites are another source of discomfort because they pressure the surrounding tissue and organs. Number 7. Indigestion. Indigestion is caused by fatty liver disease aggravated by blocked stomach acid. The liver's role is to remove poisons from the body. Because the fatty liver disease affects the liver's capacity to do so, waste accumulates, causing GERD, nausea, and unexplained vomiting. Over-the-counter drugs may be used to treat indigestion symptoms in people who do not have liver disease. According to research, reducing stomach acid can result in an overgrowth of intestinal bacteria, which causes inflammation, increased digestive problems, and more liver damage. Number 8. Red palms or itchy skin. Estradiol is an estrogen derivative generated by the sex organs and adrenal glands. Estradiol is processed in the liver, and when the liver malfunctions, the levels of estradiol become abnormal. Palmar erythema, a disorder that causes the palms to redden, might develop from this rise. Your skin can also tell you if your liver is in good shape. Because a liver condition might affect your bile ducts, there's a potential that the effects will show up on your skin. According to research, liver dysfunction can cause an increase in bile salt levels, which can build up under the skin and cause pruritus, itchy skin. However, there are a variety of reasons why your skin may itch or cause you to scratch. Number 9. Hyperinsulinemia. After eating, blood sugar levels rise, leading the pancreas to produce insulin to the bloodstream. Sugars can be used as fuel by cells or stored as fat. Insulin resistance occurs when cells do not react to insulin, causing the production of more insulin and resulting in hyperinsulinemia. This syndrome indicates liver malfunction and adds to the weariness and mental fog accompanying fatty liver disease. Number 10. Brain dysfunction. Hepatic encephalopathy, a brain disease, is most commonly caused by long-term alcohol addiction. In the case of alcoholic fatty liver disease, liver impairment implies that the organ cannot neutralize poisonous byproducts, such as ammonia. These build up in the bloodstream and reach the brain, resulting in forgetfulness, mood changes, and difficulties with minor hand motions. This disorder is 70% more likely to develop in cases of severe liver cirrhosis, yet it can also occur in people with fatty liver. Number 11. Easy bruising. Liver disease can cause frequent and simple bruising. When your liver is injured, it doesn't create enough clotting proteins, which might lead to more bleeding and bruising than usual. Other factors, however, might result in easy bruising on the body. Number 12. Loss of appetite. When you have a suppressed appetite, you have a reduced desire to eat. This indicates liver malfunction and adds to the weariness and mental fog that might accompany the fatty liver disease. It is also known as a lack of appetite or a lousy appetite. There are a variety of reasons why you may not feel hungry. However, if you lose your appetite for an extended time and experience nausea, headaches, or vomiting, it might be a sign of something more serious. Loss of appetite is another typical symptom of non-alcoholic fatty liver disease. So if you've been having similar symptoms, it's time to get your liver checked. Fatty liver disease can lead to inflammation, fibrosis, and cirrhosis if left untreated. Cirrhosis scarring cannot be reversed. Cirrhosis increases your risk of developing liver cancer and having your liver fail. These complications have the potential to be life-threatening. Do you find this video informative or helpful? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!